Alzheimer's disease is a progressive brain disorder that primarily affects memory, thinking, and behavior. It's the most common cause of dementia in older adults, accounting for 60 to 80% of dementia cases. The condition is named after Dr. Alzheimer, who first identified it in 1906 after observing changes in the brain tissue of a woman who had died from an unusual mental illness. Alzheimer's disease is characterized by the buildup of abnormal proteins in and around brain cells. These proteins form structures called plaques and tangles. As more and more plaques and tangles develop in particular areas of the brain, healthy neurons, or brain cells, work less efficiently. They eventually lose their ability to function and communicate with each other and ultimately die. This damage initially takes place in the hippocampus, which is the part of the brain essential in forming memories. That's why memory loss is often one of the earliest symptoms of Alzheimer's. As neurons die, additional parts of the brain are affected. In the final stage of Alzheimer's, damage is widespread and brain tissue has shrunk significantly. Alzheimer's disease is surprisingly common, particularly among older adults. In the United States, it's estimated that 5.8 million people of all ages are living with Alzheimer's in 2020. This includes an estimated 5.6 million people aged 65 and older and approximately 200,000 individuals under age 65 who have younger onset Alzheimer's. It's important to understand that Alzheimer's is not a normal part of aging. While the greatest known risk factor is increasing age, and the majority of people with Alzheimer's are 65 and older, it's not just a disease of old age. Causes of Alzheimer's disease. The exact causes of Alzheimer's disease aren't fully understood, but scientists believe that for most people, it's caused by a combination of genetic, lifestyle, and environmental factors that affect the brain over time. Age is the biggest known risk factor. After age 65, your risk of Alzheimer's doubles every 5 years. By age 85, about 1/3 of people have Alzheimer's disease. Genetics play a role in the more common late-onset Alzheimer's. Having a first-degree relative, like a parent or sibling, with Alzheimer's increases your risk. Scientists have found several genes that increase the risk of Alzheimer's. One of the most important genetic factors is the presence of the apolipoprotein E gene. This gene comes in several different forms, and one form, known as ApoE4, is associated with an increased risk of developing Alzheimer's. About 25% of all people carry one copy of ApoE4, and 2 to 3% carry two copies. Having one copy of ApoE4 increases your risk by 2 to 3 times, while having two copies increases the risk by 12 times. However, having this gene variant does not guarantee that someone will develop the disease, just as not having it does not ensure that they won't. Other risk factors include cardiovascular disease, diabetes, high blood pressure, and high cholesterol. These conditions can damage blood vessels in the brain, reducing blood flow and increasing inflammation, both of which can contribute to Alzheimer's disease. Lifestyle factors also play a role. Lack of exercise, poor diet, smoking, and excessive alcohol consumption may increase the risk. On the other hand, regular physical activity, a healthy diet rich in fruits and vegetables, and staying mentally and socially active may help reduce the risk of cognitive decline and Alzheimer's disease. Symptoms of Alzheimer's disease. The symptoms of Alzheimer's disease typically develop slowly and worsen over time. They can vary from person to person, and the progression of symptoms looks different for each individual. Memory loss is often one of the first signs of Alzheimer's disease. This might manifest as repeating questions, forgetting recently learned information, or relying increasingly on memory aids or family members for things the person used to handle on their own. It's important to note that occasional forgetfulness or memory lapses can be a normal part of aging. The memory loss associated with Alzheimer's persists and worsens over time. As the disease progresses, other cognitive abilities are affected. People might experience difficulty with problem solving, planning, or completing familiar tasks. For instance, they might struggle to manage a budget, follow a recipe, or remember the rules of a favorite game. They may have trouble judging distances and determining color or contrast, leading to difficulties with driving. Language problems often occur. People with Alzheimer's may have trouble following or joining a conversation. They might stop in the middle of a conversation and have no idea how to continue, or they may repeat themselves. They might struggle with vocabulary, have problems finding the right word, or call things by the wrong name. Another common symptom is disorientation to time and place. People with Alzheimer's can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it's not happening immediately. Sometimes they may forget where they are or how they got there. Poor judgment and decreased decision-making ability are also symptoms. This might manifest as poor financial decisions, like giving large amounts of money to telemarketers or neglecting personal hygiene and grooming. As Alzheimer's progresses, people often experience changes in mood and behavior. They may become easily upset at home, at work, with friends, or in places where they're out of their comfort zone. They might experience depression, anxiety, or mood swings. Some people become more easily irritated or aggressive. In the later stages of the disease, physical symptoms may appear. These can include difficulty speaking, swallowing, and walking. Eventually, the person may need full-time care and assistance with daily activities. It's crucial to understand how these symptoms might feel for the person experiencing them. Many people with early-stage Alzheimer's report feeling frustrated or embarrassed by their cognitive difficulties. They might feel anxious about the future or depressed about the changes they're experiencing. As the disease progresses, people might feel confused, frightened, or angry. They might not recognize their surroundings or the people around them, which can be very distressing. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of Alzheimer's disease. Diagnosing Alzheimer's disease involves a comprehensive medical evaluation. There's no single test that can definitively diagnose Alzheimer's disease. Instead, doctors use a variety of tools and methods to make a diagnosis. The process typically begins with a thorough medical history and physical exam. A critical part of diagnosis is assessing mental status. This involves tests of memory, problem-solving, attention, counting, and language. One commonly used test is the mini-mental state exam, which evaluates cognitive skills. Another is the mini-cog test, which involves asking the person to remember and later repeat the names of 3 common objects and to draw a clock face showing a specific time. Neurological exams are also typically performed. These check reflexes, coordination, balance, and the senses of sight and hearing. These tests can help rule out other conditions and identify signs of stroke or other brain disorders. Brain imaging tests are often used to detect visible abnormalities related to conditions other than Alzheimer's disease, such as strokes, trauma, or tumors that may cause cognitive change. Common brain imaging tools include computed tomography, magnetic resonance imaging, and positron emission tomography. Blood tests are typically performed to rule out other conditions that can cause symptoms similar to Alzheimer's, such as thyroid disorders or vitamin deficiencies. It's important to note that while doctors can almost always determine if a person has dementia, it may be difficult to pinpoint the exact type. Alzheimer's disease can only be diagnosed with complete certainty after death, when microscopic examination of the brain reveals the characteristic plaques and tangles. Treatment for Alzheimer's disease. Currently, there is no cure for Alzheimer's disease, but treatments are available that can slow the worsening of symptoms and improve quality of life for both those with the disease and their caregivers. The treatment typically involves a combination of medication and non-medication-based approaches. The U.S. Food and Drug Administration, FDA, has approved several medications for treating the cognitive symptoms of Alzheimer's disease. One class of drugs, called cholinesterase inhibitors, are prescribed for mild to moderate Alzheimer's disease. These drugs work by preventing the breakdown of acetylcholine, which is a brain chemical important for memory and thinking. They may help reduce or control some cognitive and behavioral symptoms. 3 cholinesterase inhibitors are commonly prescribed: donepezil, rivastigmine, and galantamine. Another drug, memantine, is prescribed to treat moderate to severe Alzheimer's disease. This drug works by regulating the activity of glutamate, another brain chemical that's important for learning and memory. Some people benefit from taking memantine in combination with a cholinesterase inhibitor. In 2021, the FDA approved aducanumab using the accelerated approval pathway. This drug is the first therapy to demonstrate that removing beta amyloid from the brain may delay clinical decline in people with early Alzheimer's. However, its approval has been controversial, and its effectiveness is still being studied. It's important to note that these medications don't stop the progression of Alzheimer's disease, but they can help slow the worsening of symptoms for a limited time. Other than medications, creating a safe and supportive environment is crucial. This might involve removing tripping hazards, installing handrails, ensuring good lighting, and using labels or pictures on drawers and cabinets to identify their contents. Physical exercise has been shown to have benefits for people with Alzheimer's. Regular, moderate exercise can help maintain strength, flexibility, and cardiovascular health. It may also help manage stress and reduce wandering, restlessness, and agitation. Now we want to hear from you. Do you or someone you know have Alzheimer's disease? What symptoms did you have at first? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.